And now it's time for On Point, where we speak to experts to delve deeper into the biggest news stories in the spotlight right now. Now, South Korea is finally seeing its daily COVID-19 numbers go down after the country saw figures as high as over 600,000 at the height of the Omicron wave.
However, with the country planning to scrap nearly all of its social distancing measures, could we still see the daily figures continue to drop? For more, we connect to Dr. Alice Tan, internist at MizMedi Women's Hospital. A very good morning to you, Dr. Tan.
Good morning.
And well, Dr. Tan, first off, we've been seeing a clear decline in the number of daily cases, weekly cases. So do you think we can safely say that the peak is quite behind us?
Yes, I think we can say that the peak of the Omicron surge is safely behind us. Fortunately, the number of cases of people who are age 60 and older has also been steadily declining. However, at a 7-day weekly average of about 200,000, 220,000 new cases per day, this is still very, very off of our baseline pre-Omicron. I think we have a long ways to go still in terms of decreasing transmission. The other thing to note is that the number of cases in ICUs still remains high, and we're still adding about 1,000 new deaths due to COVID every 3 days. And so these are, I think, parameters that we need to definitely look to improve. If we look overseas in terms of getting clues as to what to expect in the future, in the UK, they did have a small bump in new cases in March after the initial decline from their Omicron surge. And in the US, there are a handful of states, primarily in the East Coast, that are actually seeing an uptick in new cases already. And so it's hard to know exactly what's in the future in terms of COVID in Korea. We do know that the pool of people who are vulnerable to new infection, especially in the near term, has dramatically shrunken. But we need to be aware that immunity from booster shots, so from the third dose, immunity is probably waning. And so we might see more booster breakthrough cases in the near future. And we need to try to bring down our transmission levels down to a safer baseline as soon as possible.
So obviously, we would love to see the numbers dip down when it comes to the fatality numbers, because still seeing hundreds on a daily basis, very concerning. But despite that, what the health authorities did say was that maybe come next week, we might be scrapping nearly all these social distancing measures, aside from the obvious indoor mask mandate. Now, certainly welcoming news for a lot of people, especially the small business owners. But from a doctor's point of view, I mean, is it the right time right now? Is it too early to kind of start lifting all these measures?
Well, I think our decision to lift measures really needs to be case by case, regionally determined, and also determined in terms of the microenvironment. We can't have a one-size-fits-all policy when it comes to public health and social distancing measures. If we look overall in terms of our national weekly average for new cases per population, we stand at around 400 per 100,000 population, which is still a very high level of transmission. But there is a wide range in transmission levels. For example, we have a low of 319 per 100,000 population in the Gyeongnam province, whereas in Sejong City, they are recording a very high, the highest rate of transmission of 515 new cases per 100,000 population. And in Jeonnam also, they have 500 new cases per 100,000 population. And in these two regions, Sejong City and the Jeonnam province, they are also seeing critically low levels of ICU bed availability for COVID patients. So definitely in these two regions, I don't think it's safe to lift all measures. I think going forward, a regional approach is going to be safer. And I would actually like to see transmission levels decrease to closer to 200 per 100,000 population before we consider lifting all measures throughout the country.
And Dr. Tan, we've been hearing more and more about this XE variant that's popping up in various parts of the world. And the concern really is that it's only a matter of time before it starts showing up here in South Korea. So how worried should we be about this?
Well, the XE variant is what we call a recombinant variant. So it has mostly the BA2 genome and also parts of the BA1 original Omicron genome. We know from studies in the UK that it has a 9.8% growth increase over BA2. However, in the UK, they noted that since its appearance January 19th, it hasn't really taken off. By March 22nd, it only accounted for about 1% of all sequenced cases. So, as I said, the UK did see a bump in new cases in the month of March after their initial decline. But we think that that's more attributable to the BA2 subvariant rather than XE. I think we do need to wait and see to try to gather more information in terms of its virulence and whether or not it has the same amount of immune evasion as original Omicron. But I think the most important thing to consider in terms of XE is that it serves as a harbinger of what's to come in terms of more recombinant variants. And the next time we may not be as lucky, we may not see as a benign recombinant on the scene.
Dr. Tan, I want to kind of talk about an article that I think a lot of us had a chance to read. It was an article by the Wall Street Journal where they indicated that South Korea could potentially be a front runner when it comes to transitioning into an endemic. At the same time, a lot of people are arguing that, well, with the long COVID and these symptoms kind of lingering in a lot of these patients, could it really be treated as an endemic? I want to kind of hear what your take on this particular article, and also, is South Korea really ready to transition into that phase?
Right. For us to consider a disease to be endemic, it needs to be prevalent, but also predictable and manageable. So there's no doubt that COVID-19 is prevalent and it's not going anywhere. It's going to stay with us for many years to come. But in terms of predictability, I think it's very difficult to know what's going to happen next in terms of COVID-19. And in terms of whether or not it's a manageable disease, it is true that vaccinations have made COVID-19 a much less severe disease, and South Korea has had one of the most successful vaccination campaigns of any nation in the country, in the world. However, we continue to see very, very high fatality rates in terms of Omicron. It caused more than 14,000 deaths since January 1st. 2022. And so I think we have a long ways to go in terms of making COVID a more manageable disease in our country. Other than vaccines, treatments were supposed to be a big game changer, but accessibility to oral and IV antivirals as outpatient treatments has been very difficult to access. So I think we do have a long ways to go before we can say that we are comfortable with living with COVID as an endemic disease. It's still not predictable, and given the high number of deaths that we've seen, I don't think we can consider it manageable. And as you said, long COVID, even though there has been a decoupling effect in terms of cases and deaths, I think we will see in the future a tight correlation between transmission levels of COVID and the appearance of long COVID. And in the future, we may see a huge surge in dementia, heart disease, diabetes, all of the long COVID syndromes in our near future.
Dr. Alice Tan, thank you as always for your insights.
Thank you.